When you were diagnosed with MS and as an OBGYN, what was the first thought that ran through your mind? So I know you mentioned too that you feared that you wouldn't be able to deliver babies and continue the career. And at that moment, what felt more overwhelming to you? Was it the diagnosis itself, or was it just what it was going to possibly take away from your future? What happens when the life you work so hard to build is suddenly threatened by a diagnosis you never saw coming? Hi, everyone, and welcome back to MSwired Podcast. I'm Selena Buongiorno, physician assistant, patient living with MS, and your host. Today, I am thrilled to be joined by Dr. Suzanna Chatterjee-Morris. She's a dual board-certified OBGYN and obesity medicine physician who has built a career defined by resilience, reinvention, and purpose. After losing her father in college and facing academic setbacks, she took an unconventional path to medical school in Poland, graduating in the top of her class and matching into a surgical specialty against all odds. Just as her career began to take off, she was diagnosed with relapsing remitting multiple sclerosis and told she may never deliver babies again. Instead of accepting that, she sought a second opinion, started treatment, and never looked back. Today, she runs her own private practice and medical spa in Russellville, Arkansas, after leaving corporate medicine to create a more compassionate and patient-centered model of care. She also covers labor and delivery across multiple hospitals, mentors future healthcare professionals, and continues to show up for her patients while navigating her own journey with MS and infertility. Outside of medicine, she's a community leader, currently serving as a Rotary Club president, and enjoys traveling, cooking, and creating meaningful experiences. Her story is a powerful reminder that even when life shifts your path, you can still build something extraordinary. During MS Awareness Month this March, we also honor the strength, resilience, and journeys of fellow warriors navigating this disease every day. Dr. Chatterjee-Morris, thank you so much for joining us today. And I want to dive right into your journey because your story doesn't just inspire, it truly reshapes how we think about what's possible after this diagnosis.
Well, thank you so much for having me.
Yeah, no, I'm excited. So when you were diagnosed with MS and as an OBGYN, what was the first thought that ran through your mind?
So actually, it's interesting. I've struggled myself as an obesity medicine specialist. I've struggled myself with obesity my whole life. So when I graduated residency, I made it kind of a health goal to become very healthy. And so I was eating very healthy. I was exercising twice a day. I was doing, cardio in the morning and then strength training in the evenings. I got really into cardio kickboxing.
Oh, cool.
And I'm from Nashville, Tennessee, and so I was living near there in practice, and downtown Nashville, there was something called Hot Box, which
I've
is
heard of that.
basically cardio kickboxing, but they heat the room, and so it was it was a great workout, and so I loved it. I was kind of addicted to it, and so I would try to get into downtown Nashville, 2 or 3 times a week to get one of those classes, and so I had done one of those classes, and I woke up the next morning, and my right arm, normal night, went to bed normally, my right arm was numb, like, almost like asleep, and so I thought, "Oh, I slept on my arm." I was going into work, so I got up, I got into the shower, and then I started to notice that it seemed like it was, like, all the way up to, like, partway between my elbow and my shoulder, and so I thought, gosh, my, like, arm is really asleep. So I was doing a lot of, like, shaking it, and
Right.
I thought, "Well, by the time I get to the office, it'll be fine." And so, I went and rounded at the hospital, I believe, and then got to the office, and I thought, "My gosh, like, my arm is still kinda numb and tingly." But I went through the whole day and just kind of, like, throughout the day between seeing patients would think, "Gosh, why is my hand not." And so my first thought was I had pinched a nerve in my neck during my hot box class, and
Right.
that was why. I was like, "Well, darn, I've injured myself doing this." And so, I went the whole day. The next morning after that, I woke up and my arm was still numb, my shoulder was numb, the bottom part of my neck and the bottom part of my jaw was numb, and I was like, "I really injured myself." So, anyway, I went on to have it kinda go up a little bit, almost to, like, bridge of my nose and then across to my ear and down just all on my right side. A little bit further, it went kind of straight down the middle, all the way down to my belt line. So from my waist to my nose on my right side, I was totally numb.
Wow.
And so I think a couple days went by and I thought I need to go on my lunch. I went to go see an orthopedic surgeon and I said, I did this class and I think I injured myself. He said, hmm. And he moved me around. And he said, "Does it hurt?" And I said, "No, it's just numb." And he's like, "Okay." So he did an x-ray and I was like, "Okay, like where did I like slip a disc or something?" And
Right.
And he said, it looks perfect. And he said, this kind of looks like MS. And I was like, no, I was like, I don't have MS. I worked out too hard. And he said, okay, let's do this. And this was right before Christmas. And so he said, let's do this. Let's do no working out for a week. Let's do physical therapy. And then I was going out of town to spend Christmas elsewhere. And he said, when you get back from out of town, it'd be about a week and a half from now, after Christmas, we'll kind of touch base and see how the physical therapy is going. He said, but don't do any more exercising. I was like, okay. So I went about my business. I was at my sister's house for like our weekend before Christmas because I was going out of town that next week. So we were spending Christmas together with my family that weekend before. And I'm the one in the family that likes to cook. And
Yeah.
so I was cooking and helping my niece, who at the time was, just a few years old, to bake, Christmas cookies and do all that. And I noticed that as I was like stewing mashed potatoes and I was stirring them with a wooden spoon, and it was like I couldn't get the grip because I couldn't feel my right hand and I'm right-handed. And then I went upstairs to wrap some presents and I couldn't write. Like it was like I was writing like a child. Like I couldn't write my normal handwriting. And so again, I wrote this all off to an injury because I still, the MS comment kind of came in and went out, and it was like,
Right. And you bring up a good point too, because especially as a physician and I'm a PA, I was putting mine to, oh, I slept wrong. I had lost weight too. I had my daughter, I lost 50 pounds. My dad's like, you're just overdoing it on the Peloton. Like people put off the symptoms to something else.
right, exactly. And there was something that was like just like coincided at the same time. I
Right.
had done this like really strenuous workout. I had been doing it, and who knows, when you're punching a bag and that kind of,
Right.
what you might hurt yourself. So I went out of town for Christmas, the whole time numb from my nose down to my waist on the right side. And so when I got back, and I did physical therapy. Physical therapy didn't obviously do anything.
Right.
The heat felt kinda nice. I could kinda feel that, and that it really didn't do much. And so when I got back from Christmas, I went back to that same orthopedic surgeon, and I said, "It's not helping." And he said, "You really need an MRI." So that was lunchtime. So I went over, I believe right after, so I went to see him at lunch. Right after my clinic, I went to the hospital and got an MRI. And they said, okay, they'll call you. So probably 3 or 4 hours later, maybe 7 o'clock, 8 o'clock at night, I got a phone call on my cell phone from the radiologist. This is a hospital that I work at. So, I knew who he was. And so he called me and he said, I've got your radiology results, and, I just have to tell you that there's lesions on your brain. And my first thought was, I have brain cancer. Great. We can fix that. And that's where just where my mind went. It was like, okay, so lesions like a tumor? And he's like, no, lesions like multiple sclerosis. And I was like, why do people keep putting this diagnosis on me? That's not what
I'm
I.
impressed with the orthopedic.
Yeah, I mean, he really truly said, he said, "You're in your early 30s, you're a woman, you're having numbness with no associated pain." He said, "If you had slipped a disc or had some stenosis, there would be pain involved. And the fact that you are not in any pain at all and you're just numb, that reads MS." And so anyway, he was right. And so again, I was still kind of in this, like, I don't really know. And he said, well, maybe you should see the local neurologist. So I saw the local neurologist in my town that's about 25 minutes northeast of Nashville, and she would not give me a diagnosis. She didn't want to look at me and say that. But then she also said, you know what, you really need a spinal tap to like definitively diagnose. And I was like, okay, well, then let's do that. And she said, I can do it, or you can have anesthesia do it. And of course, I work with anesthesiologists every day.
Right.
I knew them, and I felt comfortable. And I said, well, I'll have the anesthesiologist do it. So I called up one of the anesthesiologists, and actually 2 days, so like the 30th of December, so 2 days before New Year's, I had a lumbar puncture done
Okay.
at the hospital. My mom was there, my sister was there.
Mm.
My sister's deathly afraid of needles, so she stepped out of the room during this, and they had to get 4 vials to do the lumbar puncture. And somewhere between the third and the fourth vial, sorry, between the second and the third vial, I felt one little drop of spinal fluid go down my back,
Oh.
and I panicked, and I vasovagaled, and I passed out.
Oh, geez.
And I was like, "Take it out, take it out." My mom was yelling, who was also a physician, was yelling at him to take it out. She's gonna pass out, she's gonna pass out. And he's like, "I just need one more vial, like one more." So he had the nurse actually like ease me down, and he followed me down and got that fourth,
He had a job to do.
yes, and got it done. And so I woke up, of course, with one of the recovery room nurses standing over me, and I was like, "If you tell anybody about
This
this,
never happened.
we're not gonna talk about it." Anyway, it was so, a couple week later, actually, I get results back that show that there's oligoclonal antibody, and so, I mean, I had MS.
Right.
Again, the local neurologist wouldn't tell me anything, and so she said, "I want you to go to the MS clinic at Vanderbilt," and I'm like, "So I have MS," and she's like, "Well, I think they need to review it," and so she
Right.
didn't
So
wanna tell.
did they MRI your spine? I'm just curious because usually they'll do.
They did. Yeah, they did brain and spinal cord,
Okay.
and so I had lesions actually in the brain and on the spinal cord,
Okay.
in my cervical spinal area as well as in the brain. And so I'd had that. And so I thought, okay, well, I need to see this clinic because now I've got lesions on my brain. I have a lumbar puncture that, kind of confirms it. But again, then I have this doctor that's like, well, I don't really know. She was waffling. She didn't want to be the one to give me the diagnosis, I guess.
Right. When
Uh,
was this?
this was in, so it was like early January of 2015. And so it
Okay.
started December 2014 and then went into January 15. And I was like, okay, I need answers. I need to know, what's going on. And so I called to make an appointment at the MS clinic. And this is first week in January, for second week in January. And they said, okay, well, the like MS guru, like the one that you want to see at Vanderbilt MS Center, is booked out till April. And so you can see him in April.
Oh, jeez.
And I said, okay, so here's the other thing. Of course, I was off of call. I was not delivering. I couldn't do anything. I'm right-handed. And so my partners covered my call. They covered, my patients. And so then I went back to the clinic because I was like, I've got to do something. And so I did just exams with my left hand,
Oh, wow.
taught myself to do breast exams and pelvic exams with my left hand. Doing a cervical check on a pregnant patient is very weird when you do it with your non-dominant hand. But I taught myself how to do all of it so that I could,
Good for
feel and
you.
do what I needed to do and at least do some office work and take care of patients in the office. I kept calling and I was like, is there any way? And so then I called and I said, you know what? This numbness is still going on. I'm not able to work fully. Is there any way that he will see me sooner? And so the nurse said, well, let me talk to him and I'll get back to you. So she called me back and she said, he just recommends doing high dose steroids for, I can't remember, a few days. I think it was like 5 or 7 days.
Yeah.
And then just wait to see him till April. And I was like, I don't even have a diagnosis. And nobody has given
Yeah.
a diagnosis. And the nurse, felt for me. I could tell that she was like, I said, I'm a fellow physician. Is there nothing? And I said, listen, if anything at all happens and you have a cancellation, please, please, please just call me. I was like, I will drop everything and come down there. It's like a 25-minute drive. I can be there in 25 minutes at any point. And she said, okay. So I did my steroids. I actually had the labor delivery nurses give it to me. And every day at lunch, I'd go up. They would give me my steroid infusion and then I would unhook and go back to work at the office. And so a couple weeks went by and I was feeling a little bit better, but the numbness was still there. I remember I used to like go in stores and walk around and I would try to feel fabric to see if I could feel it and I couldn't. I would put like a coin in my hand to see if I could tell if it was a nickel, a dime, a quarter. I couldn't tell. I knew there was something there, but I couldn't tell what it was. And so I would just kind of walk around and touch things and feel them to see if
Right.
I thought one day magically I would just start to feel again. And so I think I called again, like, hey, I'm just checking back in, maybe a week or two later, is there anything? And the nurse said to me, I'm so sorry, Dr. Chatterjee, but he just doesn't have any openings, until April. And I was like, but I'm not able to do my job and I can't deliver babies. I can't take call. I can't pull my weight as a physician in this practice. I can't do that for 3 months. I mean, that's a long time. And she said, I know, I'm really sorry. She said, I don't know what to tell you other than I will definitely, if anything ever opens up, anybody cancels, you're going to be the first person I call. And it just so happened that a fellow physician in that clinic who mostly does research was walking by. He happened to be an older Indian physician and he kind of, it perked up two things. One that they said doctor and the other they said Chatterjee. He knew my mom. And so he thought,
Oh.
I mean, like, as an acquaintance.
Yeah.
And so he was like, "Is that," and they're like, "No, this she's in her early 30s." And so he's like, "That must be her daughter, maybe? I don't know." And he said, "Let me see her chart." So he took the chart, he looked at it, and he was only in clinic 1 day a week at that point. And he said, "Call her back and see if she'll see me." And the nurse was like, "I think she'll see anybody." Like, she just wants somebody to see her.
Right.
And so she called me back. It was like 15 minutes later. She called me back and she said, "Hey, this doctor, Dr. Sriram, has walked by. He overheard what's going on. He decided to check in on it. And he said, if you can come this Thursday," I think that was that like Monday, I think. He said, "If you can come this Thursday, he'll see you at whatever time." I was like, "I'll be there." So I walked in and he walked in with a cup of tea and a handful of nuts. I think he was eating like cashews and almonds. He set it down. It was like 3 o'clock in the afternoon. So I guess it was afternoon tea. And he set it down on he had a desk with a computer so he could review images. So he set everything down and he pulled up didn't speak to me. He said hi to me, but then he's, looking in the computer, looking over my MRI. And then after about 3 or 4 minutes, he turns to me and he says, "So what have they told you?" And I said, "They've told me that they think I might have MS." And he kind of took a deep breath and he said, "I don't think that you have MS. You definitely have MS." And so that was the diagnosis. But it took, probably over a month or right at a month to get a diagnosis.
And talk about being at the right place at the right time.
I know, right? So I have been very loyal to him. I still drive back to see him. Well, I did until last year. My insurance cut out of state coverage. And
Oh,
so
I
since
hate
I
that.
live in Arkansas now, I haven't been able to see him. I do have a great neurologist here in Arkansas now that takes care of
Good.
me. But I'm hoping that at some point I can switch policies and still be able to see him because I really honestly feel like I owe my life to him.
Yeah.
Had not seen me very quickly. He said, "We're going to start you on this medication." I picked that medication up that same day. Actually, I was leaving to go out of town. I was dating somebody out of state in West Virginia, and I was leaving to go see him. And so I had the prescription. They were going to, coordinate sending it all to me. And I said, "Okay, go ahead and do that." But my ex, so my boyfriend at the time, he knew the head of neurology at West Virginia University. So scheduled an appointment for me to get the second opinion with him because I thought, well, it's Vanderbilt, but if you can get an opinion
Right.
from the
Why
direct
not?
West Virginia University, why not? So I did that, and of course he agreed. He agreed with the therapy that Dr. Sriram had recommended, and so it was like, okay, I have the go ahead, and so I started interferon injections every 2 weeks, and within probably a month, I could feel again. And completely. So I went back and saw both doctors and got a clearance because my employer wouldn't let me go back to taking call and operating. But they did all sorts of tests and I could feel and I knew what was going on. I could feel fabric, I could feel coins, like everything was
Yeah.
all gone. And so I was back to work.
That's
And
great.
it was like, okay, great. I'm going to take these shots every 2 weeks, except for the fact that they made me feel like I had the flu for about
Yeah.
3 days. I could drink a lot of water and that would help. So I did that for a couple of years and found that I was having, just a lot of fatigue, sometimes some muscle spasm and that kind of thing. Not really numbness again ever or loss of strength. That was that only that one time. Thankfully, since then, I've never had any more problems like that. But I was, just kind of not sure that it was great. So they were doing follow-ups and MRIs, and there was no new lesions and no new lesions. And then at some point, my doctor at Vanderbilt said, I don't know that this is working as well as it should be. So there's this new infusion. It's monoclonal antibody. You do it twice a year. It's a 6 to 8 hour infusion because it had just come out.
I know it will.
Yes, and so, I started on Ocrevus, I guess it's been 4 years ago, 5 years ago.
Okay. Me too. I started it in 2020 when I got
Wow.
diagnosed.
Yeah, so it's been well, actually, it's been longer than that. Gosh, so because it was before COVID. I think so I did 2 years, so 27 somewhere between 27,
Okay.
2018. I think maybe Ocrevus came out in 2018, I think that's when I switched, so it was the same year that it had come out. So I guess I've been on it for 8 years now. The
That's
time goes
interesting.
by, so,
Yeah. It's interesting what you said about your hands too. That's how I found my diagnosis. So I had bilateral tingling, and I got to the point where, like, when I shampooed my hair, it felt so weird. And the best way to describe it was almost like I was sanding something and it took
Mhm.
off all the skin on my fingertips. Is that how yours?
Yeah, it was a mixture of that and, like, it was asleep. It's that
Yes.
tingling feeling like it's asleep, and I remember walking around and just shaking my hand all the time because it
Yep,
was,
me too.
like, maybe that'll make it wake back up, and I even considered, like, would wrist splints help? And I'm like, "That's carpal tunnel, that's not
Right,
gonna."
that's what I was thinking too. I'm like, is it worse when I sleep? Do I wake up? Like, should I put it in a position of function? Because my background's in orthopedics as well, and I'm like, this is not orthopedic.
Yeah, and that's
So
exactly it is I went straight to an orthopedic problem because of my lifestyle, and that wasn't it at all, and so it's interesting because I thought, I'm gonna get the healthiest that I've ever been, and then I got a chronic illness diagnosis.
that's same. Like, I lost 50 pounds. I was feeling great. And then all of a sudden I started having this pain, and everyone's like, well, you're just overdoing it.
Yeah. Yeah,
Well,
that's
it
exactly
wasn't.
it. Yeah.
That's interesting. Yeah, a lot of like, and I know you mentioned too that like you feared that you wouldn't be able to deliver babies and continue the career. And at that moment, what felt more overwhelming to you? Was it the diagnosis itself, or was it just what it was going to possibly take away from your future?
Yeah, it was really more what it was gonna take away from my future. I think for me, I got, that month where I didn't have a, like, certain diagnosis was probably the hardest for me because I've always been the type of person that, like, if I know what I'm up against, I can do it. I just need to know what I'm up against, and it was the unknown and that lack of control of knowing, like, if you tell me this is gonna fix something, then I'm gonna, by gosh, do it however I
Right.
can, but I didn't know what I needed to fix, and so that was really hard, and then the next thing is that I kept going back to I had done a C-section, like, 2 or 3 days before that, or I think 2 days before, that when I woke up and I was numb, and I kept going back to, "Is that the last baby that I will ever deliver?" And it broke my heart because I was
Yeah.
a year and a half into my career. I mean, I was so new to it. I only got to I did it 4 years in residency, and then I got to do it for a year and a half, and I thought, "Is that it? Was 5.5 years all that I get out
Oh,
of"
yeah.
and of course, the first 4 years you're learning, so it was kinda like, I mean, I delivered a lot of babies, but, I was a year and a half into my career, and it was scary of the unknown, and then when I finally got that diagnosis and knew what I was up against, it was like, "Okay, but am I going to be able to go back?" Because at that point, when I finally got that diagnosis, I was still numb.
Right.
And I had gotten it was interesting because my weakness, resolved first, and so I had grip strength and I could write and everything, that came back first, but the numbness was just still there, and it was like, like you said, you put something there and you're like, it just feels weird,
Yeah.
It's like, something is there, you're touching something, but you can't tell what it is without looking at it.
Yeah, I had trouble putting my daughter's hair in a ponytail, and that was kind of the final straw for me. I'm like, all right, I need an MRI. And I thought it was my neck. I figured it was a herniated disc. It was December 15th. And I'm like, oh, I'll just get an epidural before Christmas. And it was not what it was.
Yeah.
Um,
Yeah, yeah, a lot of similarities.
yeah, no,
Yeah.
for sure. And how did MS, would you say, challenge your identity, both as a physician and a female, being a woman in the medical field?
Yeah, it's again, I thought, okay, so there's a couple of things here, am I going to be able to practice, and, I think a lot of people tried to like boost me up and cheer me up and say, like, there's lots of things you can do that aren't clinical as a physician. I mean, you're an MD and, you've been in practice, you can, teach, you can, do consulting work, you can do telehealth, you can do office GYN. And I was like, but I want to deliver babies and operate.
Yeah,
I wanna do. So I wasn't real keen on any of that, but again, I think that I was so focused on what my life was going to be and what I would be able to do, and I think the biggest thing is and, living in the South, there's, of course, I mean, all over, but in the South, I feel like it's even more so like this male and female roles, right? And so, like, men are the ones that go out to work and women are the ones that stay home and raise the children. And, I was a female physician, and this was a more and more common thing, but we were still the minority.
right,
So I thought, great. What happens is that male physicians already undervalue us as female physicians. And then now I have this chronic illness that prevents me from pulling my weight. And that's always been something that has been like a sticky subject for me. I don't ever want someone to look at me, even now, and say MS is causing her to not be able to do as much, or she's not doing as much for whatever reason. Because for me, it's like, I want to do it. I want to do it and I want to take the responsibility for it. And I don't ever want anyone to look at me and say that I'm lazy or that I'm not capable. And the MS diagnosis is kind of what bucked that. It was like, I,
Right.
I don't know if I'm going to be able to do that. And it may be completely 100% out of my control. I can't spend more hours. I can't do more studying. There's no way that you can just make this go away. And it was scary. I mean, that's what
Of
I thought.
course.
This is going to be the end. And they're going to go, oh, well, you know, she's sweet and she's pretty. And, I guess she's going to not be practicing anymore. And, it'll be this like tragic story, I guess, is kind of
No,
how
well,
it.
you're the opposite of that.
Yes,
And I
exactly.
know if chronic illness taught me anything too, and I tell my patients this, it's like as long as you give your 100%, that may look different every day. But
Yeah.
as long as we're giving 100%, that's what we do. And I was so impressed. I read your bio and I see your photos and I follow you online, and you continue to perform at such a high level despite your diagnosis. So, are there any specific mindset shifts that helped you move kind of from this fear to functioning to obviously thriving like you are?
Yes, I think the biggest thing, there's two things. One is that of course, I'm a physician, so I research things, I look into things, and I made a promise to myself after reading a couple of really scary stories about MS patients that were wheelchair bound and couldn't urinate and had to have a catheter in. I said to myself, I am not going to research this disease. I don't want to know anything about it. I don't want to know because and the thing that they always say is that MS is a snowflake disease.
Right.
So, no 2 people are the same. So, if that's the case, then what good does it do me to read about other people's stories? And of course, I've seen patients along the way. I have patients that have MS, and their MS looks different than mine.
Right.
And, so I thought, okay, so number one, I'm not going to compare myself to anybody else. I'm not going to read about what might happen because it might happen and it might not. And so I have control over what I put into my head and what I look at and consume. And so I'm not going to do that. But I still, I need to know what the disease is. Of course, I knew I had
Right.
in school. But also, it was like, okay, so here's the other thing is, even though I'm not going to look into what might happen, in the back of my head, I know what might happen
Right.
in a general sense. So then it was like, okay, so 5 years from now, 2 years from now, tomorrow, 20 years from now, I might end up in a wheelchair and not be able to do this anymore. And so I have this like, I've got to maximize my life. If that last C section I did was the last surgery and the last baby that I had ever delivered, then that would be the last one. And that would be the one that I'd remember as the last one. And so to some extent, it's like, this may be the last time that I can do this. And I don't think that now, but at the time I did. It was like everything that I did, it was like, this might be the last time. This might be, let me go on the trip. Let me buy the Chanel purse. Let me, move states by myself, single, and just let me just do the things that I want to do because this may be my last opportunity to do them. So it was kind of both of those things. And it's interesting too, because even in my relationships, my personal life, the person that I was with at the time of my diagnosis was not very supportive and I think took my diagnosis worse than I did and didn't really know what
Wow.
to do with it. And so that relationship ended up ending, fortunately.
Yeah.
And I, like I said, moved, stayed single. And I kind of thought I dated a little bit. And I kind of thought, like, who wants to date somebody that has MS that might end up in a wheelchair one day? I dated a couple people. I didn't tell them about my diagnosis. I would like go to MRIs and go to visits and stuff. And I would just tell them I had a doctor's appointment. I didn't. I didn't tell them the details. And so the interesting thing is my now husband, we met in 2015 after I had moved here and we went out to dinner and I didn't really try. It was a Friday night. I had worked all day. I went home, threw some jeans on and, put my hair up in a bun and kind of touched up my makeup a little bit. And he took me to a restaurant in a nearby town. And I just sat there and I was like, listen, I have MS.
Lay it all out. We're gonna save some time.
And I just was, and it was funny because he had been divorced and he had dated a little bit. And of course, people try to put their best foot forward when they go on a.
Right.
And I was just kinda like, "Listen, I didn't think it was gonna work out. I was like, "I have MS. I might end up in a wheelchair one day. I don't know what my life looks like. You know, this is maybe not something you wanna sign up for right out of a divorce, especially." And I guess that, like, being so real was something so different for him that he hadn't seen. And any woman that he'd been with, it was always like, "I have to put on this show and put on this,"
Right.
and I just wasn't trying to impress anybody because I was like, this is me. And I think
Right.
a lot
Take
of
it
it
or leave it.
is I went into it thinking like, I'm not gonna meet a man in Russellville, Arkansas, and I actually said that multiple times because it's a small town. I think there was a population of 30,000 at the time, now it's 45,000. Uh, but, 30,000 people, it's a small town, there's not a lot around. It's an hour to Little Rock, who how are you gonna meet a man in this small town?
Right.
I was very close-minded, and then I ended up, meeting my husband. So it was interesting because for whatever reason, though, I had not told other men that I had dated that I had MS, and with him, I laid it all out there. It was like I felt comfortable, and I wanted him to know. I wanted him to know on the front end, so he knew what he was signing up for. Obviously, 10 years, almost 11 years later, we're married and we're together, and so it wasn't a burden for him like it was for other people.
Well, that's awesome. And I know when I got diagnosed, you listen to country music, I'm assuming, because you keep saying you're from the South. But
Yeah.
Tim McGraw, Live Like You're Dying.
Yeah.
Like, I was emptying my Amazon wish list. We built a pool. I said to my husband, I'm like, this is it. Like, nothing. So, I mean, it's just, and I'm like, this is what it took for me to live. It's crazy. And living with a chronic illness, too, can shape people in different ways. How has it influenced your mindset and how you show up in life each day? I know you touched on it a little bit. Like, so it kind of did it reevaluate your priorities? Like, I love that you just went on a date and like completely different and it worked.
Yeah.
So anything else you can think of, like that just like your mindset shift that after the diagnosis?
Yeah, I think that, I learned to appreciate, all the moments, and to appreciate the people that are around me and the support that I have. And, it's really in those times, as you know, that you find out who your people are.
Yes.
The ones that aren't gonna support you through it are not the right people. I will say it is definitely a mindset thing 100% because here's the thing is I could go have gone 2 ways. I could have and actually my ex-partner told me from my practice told me that he said, "Do you have disability insurance?" And I said, "I do." And he said, "You are stupid." He literally called me stupid. He said, "I should cash in my disability and sit at home." And I was like, "I don't wanna cash in my disability because 'cause I'm not disabled. I can do this."
Right.
And so it was one of 2 things. I could cash in my disability and stay at home and let MS define the rest of my life, or I could continue on and do the thing that I had worked so hard and had dreamed of my whole life and continue to live my life until I can't anymore. And I find that, with MS patients or chronic illness patients, there really is that, like, bifurcation. It's like one or the other. It's one extreme or the other.
Right.
And I see patients all day long, and I know there are certain chronic illnesses, of course, that are much more debilitating or symptoms that are much worse. And so I'm fortunate to be in the position that I'm in, but I think a lot of that is mindset. I think a lot of that is making sure that I'm on, a disease modifying drug and I
Right.
stay on that. I don't fun of it. I know that there are diets and protocols and all these things that you can do that are more natural, so to speak. But for me, this is working and it has worked for this long. And I remember my neurologist telling me that first day that your prognosis for this for the rest of your life will be defined in the next 5 years. If you can avoid a relapse for the first 5 years, then you will do much, much better. And so I literally like counted down the days
You
to
gave me chills because I just hit 5 years in December.
yes. And
And
that
I agree with you too. And some people are so against medication, that's your choice. And they're
right.
so, but I think that at the end of the day, I'm board certified in lifestyle medicine. I think it has to be a complementary approach,
Yeah.
like you're saying, the exercising and everything. And I'm an endurance cyclist, and people say, well, why would you cycle 100 miles? Why would you possibly spend 6 hours on a bike? And my answer is always the same because I can today.
Yeah. Yeah.
So like you said, and I know you and I are positive, we seem a lot alike and, we fight our fight every day, but there are difficult days. That's just
Yeah.
what it is. And what does a difficult MS day look like for you that people may not see? Because this is an invisible illness. So many people tell me, we look great. Thanks.
Yeah. Yeah.
But
Yeah, absolutely. It's funny. I saw a neurologist at one point, several years into my diagnosis, and he didn't get my records. And He's like, "You look so good, like, you don't have any numbness, you don't have any of this and that, and, whatever." And he's like, "Are you sure you have MS?" And I was like, "Yeah, I'm sure I have MS." And he's like, "I don't know, like, what you're describing," because I kinda told him the story. He's like, "I've requested your records and your MRI," and he said, It sounds like a transverse myelitis, like, you maybe it was just a one time and done, and, like, now you're good, and you actually don't have MS." And I was like, "Well, I had," and he's like, "Well, I would have to see your MRI," he's like, "Because the lumbar puncture can be, that can be a false positive." And, so then all of a sudden I was on this roller coaster that lasted like 30 minutes because I was like, for 30 minutes, I thought, my God, like I gotta call my husband. I don't have MS anymore. Like this was a transverse myelitis flare and now I'm good. And I said, so as I was leaving, he's like, well, when I see your MRI, we'll talk again. And I was like, "Well, I have a picture of my MRI on my phone. Would that?" And he's like, "Oh yeah, let me look at it." So as I'm turning it, like it doesn't even get all the way around, and he's like, "Oh yeah, you've got MS." And I'm like,
Thanks for confirming.
it's like, "Oh my God." Why? And I thought to myself, why would you ever give a patient like me hope like that?
Right.
Because it's like, I would just say, "Well, I don't really know." So everybody has their own methodology of doing things, but
Yeah.
it's just, me, we are positive. And what I always think of though is those that aren't. And, I think that there's this, it's like people talk about mom guilt. I feel like there's this like chronic illness guilt that happens where it's like, why can't I do that? Or why are like they're doing so much better than I am? And it's like you start comparing and so to some extent, it's like, I think that, like you said, it's invisible. I look healthy. Everything seems fine. And so people don't really understand that there is a struggle there. And those struggles for me are fatigue, just incredible fatigue.
Right.
I don't know how many times it's like I just wanna lay down and take a nap, but my job doesn't allow me to do that, and actually, of all jobs, I don't get to sleep at night even half the time, so it's even more so, just difficult, just really being fatigued. I do have muscle spasms as I get so you may be familiar with this, so Ocrevus, is every 6 months.
Mhm.
There's something called the crap gap.
Yep. I get it at month 5.
Yes, exactly. It's like on the dot. Like I cannot look at a calendar, and I know when I'm due for my Ocrevus infusion because I don't lose strength by any means, but I start having muscle spasms that bother me. I have tingling in my hand. Sometimes I think my staff and my husband will see me kind of like opening and closing my
You're
hand.
like, "She's due."
Yeah, and it's like it's uncomfortable. And that last month, it's like I get migraines. I'm so exhausted.
Same.
And I have these like, kind of just spasms that are uncomfortable. So, those are things that, I deal with. And, I've been pulling a baby out and my hand spasm and I keep going and get the baby out safely and then, kind of stretch my hand a couple times and then keep doing what I'm doing. So, it's you can let those things like, I could let that 1 month so twice a month twice a year, 2 months
Right.
a year, I could let those be, like, the months that I'm just like, "Well, I can't do anything, and I'm gonna take off work, and I'm not gonna,"
Right.
and that's just not me, and I get it, I know that like I said, I know that there are people that can't push through what their symptoms are, but a lot of it, again, I think is mindset. I mean, you have to speak it into existence,
Yes.
the more positive you can be. It's, MS is a neurological disease, and if we can, part of that is mental health and mindset, and if you can stay positive and, continue to try to just look at the brighter side of things. I mean, I find that that's something that helps in any type of disease. I mean,
Mhm.
if the people that stay positive, I feel like do thrive, and those that allow it to define them and allow it to like take them down, basically. And so I think part of it is just the stubbornness of being like, I'm not going to let this define me. I have MS. MS does not have me,
Right.
and I'm not going to let it take me down. I'm going to take it down and keep doing what I need to do.
No, that's awesome. And I think, like you said, too, not comparing because it is a snowflake and comparison is the thief of joy. And I remember, too, I like what you said about the crap gap because I was telling my doctor, I was sure I was having a relapse, but it wasn't. We determined it was a pseudo relapse and then we determined it was crap gap. And he's like, well, we can switch drugs. And I said, no, because from what I read on forums and hear from other people, that's kind of common with this drug. And so it's just interesting how a lot of us have that.
Yeah.
But you've supported countless women through fertility, obviously, with your career, and then also IVF. And then I know that you found yourself personally on that path, and you're pretty vocal about it.
Yeah.
How did your diagnosis shift the way you thought about fertility and ultimately lead you towards IVF? Or did your diagnosis have any role in that?
So, I really don't know what had a role in it other than, there is, in my mind, I wonder if the Ocrevus somehow. So I have endometriosis, which I had prior to having MS, and then I have diminished ovarian reserve, and so I just don't have the eggs and the egg quality that other people do. I did have an ectopic pregnancy when I was in residency and had surgery for that, and that was due to the endometriosis. And then everything was fine. My periods have always been normal. And so, again, the delay in my fertility was really career related. So it wasn't because
Right.
of MS. I thought, you can go on and have children. And actually, my neurologist was encouraging me to get pregnant. And I was like, I'm single. I'm just going to go on and get pregnant. But he said, because pregnancy is, you go into remission from pregnancy
Right.
because of, we think because of growth hormone. And actually, that's what my neurologist studies is what role does growth hormone have with MS? And so it really was more career, reasoning and then meeting the right person and all those things. And then by the time we tried, and we have both male and female factor infertility. So my husband had low sperm count secondary to taking testosterone replacement therapy. And so it was like I had not enough eggs, he had not enough sperm. And then here we are. And then we ended up, with a clinic that just wasn't the right fit for us. And so then there was a delay and, that type of thing. And so we've done, I don't know, I guess 10 rounds now of egg retrieval. And the interesting thing about it is that the infertility actually, in a lot of ways, positively affected my MS. And so I didn't get crap gap when I was doing
The
meds.
hormones.
Right. And so again, you're taking Omnitrope, which is growth hormone. And so, and then also, they say pregnancy helps too. So it was like all those hormones and then the growth hormone helped. And so for a couple years, I didn't experience crap gap.
Interesting. So that's all I have to do. I'm just kidding.
Yeah, exactly. I should say, I mean, it wasn't as bad. Like, it was still there and I could
Right.
still tell, but it was definitely not as pronounced. So I really think that, I wonder sometimes, like, did the Ocrevus have something to do with affecting my ovaries and, what was there? We don't know. And it's one of those things we'll never really know.
Right.
But, it's one of those things where it's like, one thing after the other, and you get over one hurdle and then there's another hurdle.
Right.
So I switched clinics, I went through egg retrievals, we got all these eggs, I was so excited, and then we had one normal embryo from genetic testing and we, didn't that wasn't a successful transfer. And then the other interesting part of fertility is carrying a pregnancy. So again, pregnancy is, a lot of times good for your MS, for relapsing remitting. And yet here I just had opened a practice and I talked to a fertility specialist in Louisiana that I actually was referring to pretty frequently. And he and I did a consultation over the phone. And I said, I want to, I think, do egg donor and use my husband's sperm. And he said, in the state of Louisiana, it is illegal to donate your eggs or use donated eggs, and so
Wow.
he said, "I can try to get your eggs here in Louisiana, but I can't use donor egg because that's punishable by fines and jail time actually for the physician
Wow.
and the person that's involved in that." And so we talked a little bit and, he said, "Have you considered surrogacy?" And I was like, "No, I don't wanna do that because if I'm not gonna use my eggs, then at least if I carry the then it'll somehow be more my child." And so that was a hard thing to get over. It took me a long time, but he said to me in that conversation, he said, "Listen, are, in at that point, like, late 30s, about to be 40, or actually right at 40, and he said, "You've just opened a practice, you're busy and you're running around. What happens when you get gestational diabetes or gestational hypertension or preeclampsia and you're on bed rest or something else happens or there's a complication with the pregnancy and then you can't work? What happens?" And I was like, "Well, I guess I'm out, I can't, And then it was like this light bulb went off, and I was like, so, and he said to me, he said, "So sit down and think about what the cost is of a surrogate versus what the cost would be of you not being able to run your practice for however many months." And I was like, "Wow, that's pretty that was pretty impactful." Now,
Yeah.
so then we went on to say, "Okay, well, here's the other thing," and now, of course, I'm older, and so to try to carry a pregnancy at my age, there's a lot of risks, of course, and I know those things. And so now we've kind of come back full circle to donor eggs, my husband's sperm, and then a surrogate.
Okay. Whatever your journey, it will be successful.
Yes.
And how has your own journey with IVF influenced your approach to caring for patients navigating fertility? I mean, I'm sure, do you share with patients or have you held, does that change anything for you?
I think it makes me more, I guess just more empathetic, and I get it, and I do. I share with them, and it's interesting because my husband is the opposite of me. He doesn't have any social media. He doesn't like sharing things publicly. He doesn't stop me from doing it, but it's just not something that he prefers to do. And for me, it is, it's like a form of therapy, to
Me
like
too.
share my story and allow people to not feel so alone because even 4 years ago, there were a few physicians, mostly reproductive endocrinologists that were talking about infertility and their own journeys with infertility, but there just weren't a lot of people talking about it. And now it's kind of become a little bit more popular, however, or mainstream, but it's still not, I think, talked about enough. And there's a lot of misinformation, a lot of confusion about infertility and those types of things. So,
I agree.
I think that by sharing and, kind of having this community of people, I mean, it really does help make you not feel so alone, but then also feel like you're helping somebody. And so, in that, as I have shared, I've actually acquired a lot of patients. A lot of
That's
people have
awesome.
actually come to see me. I've had people come from all over the state to come see me just because they feel like they can relate to me in one way or the other, and that I understand. And when they tell me what they feel or how, what they're going through with their infertility journey, they know that I truly understand. And that's a big thing. I mean, when you
Hmm.
go somebody that really understands, because it makes it's just a completely different experience.
Yeah.
You feel heard just by way of that person being able to relate to exactly what you're going through.
Right. It's not just someone behind a clipboard giving you advice that they've never been in those shoes. So
Right.
it's amazing. That's why I love working with MS patients too.
Yeah.
And for any women living with MS who are thinking about pregnancy, or is there any advice you could give them kind of going into that journey, like anything that they could do?
Yeah, so and this is something that I think that I recommend to all women. I was an OBGYN resident. I rotated through reproductive endocrinology and fertility, and I saw women that were going through infertility. And I remember thinking to myself in my early 30s, if I haven't had a baby, I'm gonna freeze my eggs and I'm gonna, do that for myself so that I have that for whenever I do end up having a child, in case of anything. And I got to my early 30s and I was in a relationship and I thought, well, we'll get married, we'll have kids, I don't need to do that. And I didn't do it. And that's probably one of my biggest regrets. And so I think for anybody with any chronic illness, I think my advice is to find a way to preserve your fertility. And that's typically, freezing your eggs. And it is a cost and it can be burdensome. However, there's lots of grants and programs and things that you can do. But, I feel like if you're able to, and you can somehow preserve your fertility by preserving, freezing eggs, that's what I would recommend.
That's interesting. I know we may have touched on it before, but how does MS typically behave during pregnancy? I know we mentioned like a lot of people will say that they go into remission, or what do you see? Like, do symptoms improve, worsen, stay the same?
Yeah, they seem to improve during pregnancy. However, we do know that relapse is very common afterwards, and so there's something about that postpartum state and the hormones and the withdrawal of those hormones that causes it. The other part of that is epidurals. So I have
Uh,
talked to a lot of anesthesiologists about epidural, for labor when you have MS. And the overarching thing, I've read lots of articles that they've given to me about how an epidural can actually also cause issue when you have MS and cause you to relapse as well. And
really?
So there are a lot of anesthesiologists that I think really take pause and really don't want to do an epidural, and so it's it's interesting because it's like not only do you have to think about like how you feel during, but then there's the whole
Right.
process. And then also just the stress of labor and delivery, however you do that, that can throw you into, a relapse as well. So it's one of those things where it's like, well, yeah, that's great. You can get pregnant and you can
Right.
feel
Then what?
maybe, but then what happens after? So to go through, and this was another consideration for me, like to go through postpartum, but then also go through a relapse, what does that look like? Because
Right.
postpartum is already hard enough. And so having a relapse of your MS on top of that, I can't imagine.
Do they have any correlation? Like, I've never read about this, I've never thought about it, but, like, with breastfeeding, is there any, like, protective benefits or anything to do with, like, stopping a relapse or anything with breastfeeding or no?
I'm not sure that there is. I do know that, what my doctor told me was if I did, because he, of course, he knew and was following me through doing IVF, and the original plan was to do IVF and to carry the pregnancy. He said to me, "You can breastfeed for 3 months, and then we gotta get you back on Ocrevus."
Medicate, right.
And so I don't know that there's a lot of information about it because I
Right.
think most people have been limited to how long they're allowed to
To get
breastfeed
back on the medications,
to get
yeah.
back on medication. So, it's hard to say. I don't know. I mean,
I was just
it's something
curious.
interesting to look at for
Yeah,
sure, and to study. And there may be studies of that. And like I said, I've tried to stay away from some of
I
that,
agree.
just because it's like, I remember, I remember reading something about somebody having urinary incontinence. It was like, I don't know, 6 months later, I don't know what I did, but I guess I waited too long to go to the bathroom, and I was, like, rushing to get to the bathroom, and I kinda, like, leaked a little bit, and I, like, went into a tailspin. It was like, "This is the end of it. I'm not gonna be able to hold my urine anymore."
Not bad. It's like when you know too much, it just doesn't go well. I'll never forget, my daughter must have been like 2, and she was sitting on a soccer field, and I said to my husband, "She must have tetralogy of Fallot, like, she must be trying to breathe." My husband's like, "No, she's pooping." And it's like you almost think like I'm like, "No, I learned about this. That it's a heart problem, clearly, like, she's trying to breathe." He's like, "She's pooping." In the corner. And it's like sometimes when you know too much, you think of it in the back of your mind, and I'm like, no."
Yeah.
But that
Hard
brings
to
me to my
hard to turn that off.
yeah, yeah, never. I know. He's the calm one. I remember my son had a circumcision and I was like, "It looks so red. I don't know what to do." He's like, "Maybe Neosporin." I'm like, "That's brilliant." Like, you forget your common sense.
Yeah.
And how do you approach medication management before, during, and after pregnancy in patients with MS? Like, if they came to you wanting to get pregnant, like, what do you do in terms of like timing? I know we have to time vaccines around Ocrevus. Like, is pregnancy treated the same?
Yeah, similarly. So I know that, you can. So now there's lots of data. There's been a lot of women that have gotten pregnant while on Ocrevus, and it doesn't seem to cause birth defects or anything. And I mean, it's monoclonal antibody. So, I don't know that there's a like risk. And so even through my fertility treatments, I was, basically told to continue my Ocrevus infusions and not stop them until I had a positive pregnancy test. So, if it was like I did an infusion and then I got pregnant
Right.
after, it was fine. I mean, what I was told was 2 weeks. The ideal thing is like to have an infusion and then like start IVF or start a
Okay.
pregnancy, 2 weeks later. And then of course by the next 6 months, you know whether you're pregnant or not.
Right.
And so you know whether to get it or not. But again, what I've read is that there have been many documented pregnancies with patients that were on Ocrevus that had gotten Ocrevus during the pregnancy because they didn't know they were pregnant,
Right.
and none of those babies seemed to have any, issue. Of course, the drug hasn't been around for a ton of time, so I guess that remains to be seen. But I think that the recommendation, at least for me, was continue as is until you get pregnant. Don't continue to get infusions during pregnancy, and then breastfeed for 3 months and get back on your medication.
That's interesting. And then what is the risk of relapse during pregnancy versus the postpartum period? I know you mentioned like you see it more during the postpartum period, right? Because the pregnancy, they're kind of protected almost.
Right, and so that's, we see so much of remission during pregnancy, and then that relapse is really in the postpartum phase. So, I mean, it's very disproportionate, the number of symptoms that worsen during pregnancy versus postpartum. Postpartum just wrecks a lot of things. It's hard. I see it every day, so.
Yeah, I bet. And if someone listening feels like their diagnosis has taken away their future, what would you want them to know from your story?
I think that, a diagnosis can't take your future away. That's in your control. And so you have to take control of what your future is going to look like. I think you have to sit down and decide what you want the rest of your life to look like. Do you want the rest of your life to look like, doctor's appointments and having MS and everybody in the world knowing that you have MS and that you just can't do things and your limitations and focusing on that? Or are there things and dreams and goals that you have, and how do you reach those? And no matter how severe your symptoms are, there's going to be some way that you can at least move toward some of those goals, and work on them. Why lay down and just
Right,
shrivel up?
right.
I mean, I think really my constant advice for anybody, whether it's MS or chronic illness or cancer or, just PCOS and endometriosis, or any of these things, heavy periods even. I always tell people, there's a way that we can get you to where you can still do the things that you want to do. And this is kind of a thing off to the side that you deal with. And so I guess a lot of it depends on how much priority you put on it. Of course, it's a priority, meaning you have to address it. But is that like your central focus all the time? Like every time you have a bad day, are you saying that it's because of this? Or, every time something hurts, it's because of it. It just,
Yeah,
it's like you can control how much you think about it. And so, of course, in the beginning, when you first are diagnosed, it consumes you. It has to. I mean,
yeah,
that's it. But as time goes by and as you continue to take care of yourself and do things that are healthy for you and live a healthy lifestyle and eat properly and take medication, there's no reason why you can't continue to live and do what you're going to do. So, I think all the time, let's say I never did deliver another baby, I think about it and I think knowing myself, I would have found something to do that still fulfilled me. And would it have been the same? No, but I would find a way to thrive that worked. Even if I could never feel again and never, have the strength to deliver and take call and do surgery, I'd find something that I like to do. I've always wanted to write a book. I wanted to own a flower shop. I wanted to own a coffee shop. I mean, there's all these little things that have nothing to do with medicine, even
right.
that I've always kind of wanted to do. And so I think that whatever it is that is going to make you happy and those passions that you had either before a diagnosis or that you come up with after, go after them. An employed physician, I was going to stay employed. I was never, literally, is what I said, never going to own my own practice. And I didn't want to do that. That's not what I was going to do. And here we are.
Yeah. You're glad you did.
Yeah, I mean, it's interesting because, of course, I do a lot of with medical weight loss. I do a lot of GLP-1s.
We did a research study recently with Alzheimer's because the
Yeah.
GLP-1s, what have you seen any GLP-1 improvement with MS?
Absolutely. Yeah. I mean, I think any type of inflammation, any
Right.
type of like autoimmune illness, I mean, it gets better. It really does.
Do you think it's just catered around the inflammation? Because lowering that inflammatory risk?
I do. I mean, I think that's a lot of it because what we see with GLP-1s is that, like, people that have joint pain, that have rheumatoid arthritis, that have, MS and, these other autoimmune illnesses, they seem to get better. And so then I have patients that maybe have reached their goal weight or, and have maintained it for a while, but they still don't want to come off of the GLP-1 because they realize how much it actually helps whatever other symptoms they're having. So, I mean, I think, MS is it's all about inflammation, right?
Right.
Demyelination. So if you can reduce the amount of that you have in your body, absolutely, it's going to help. There's just so many things. Of course, the hormone regulation, and of course, weight loss is important, and allowing you to do physical activity and all those things, to eat the proper things, to stay away from inflammatory foods. What we find is that you don't crave as much of that when you're
Mhm.
on a GLP-1, and so the GLP-1 really makes a big difference, and that's something that, people were afraid of, and with a GLP-1, we talk about if there's a chance of medullary thyroid cancer,
Right.
and so that's a risk too, but it's like, how many people are actually getting thyroid cancer versus how many people get such a benefit from
Right. I
from
always used
that.
to I rewrote a lot of it when I did primary care. I did a lot of weight loss, and I used to say, like, "Well, do you have medullary thyroid cancer or any history of medullary?" And they're
Yeah.
like, "What's that?" I'm like, "All right, don't worry about it."
Yeah, it's like, do you have, any type of
Multiple
thyroid?
endocrine neoplasia type 2. Wow, we're
Yeah.
good.
I know, I tell patients, I go through my whole thing, I still see a lot of new patients for weight loss, and I say, any family history of multiple endocrine neoplasia,
Yeah.
look at me and I go, "If you've never heard of
Yeah,
that,
we're
you
good.
have a family history of it." Like, if like, you people that have that in their family history, they know. And
Right.
so it's like, if you never heard of it, don't worry
I
about
think
it.
I had one patient, he's like, "I think my mom had that." I said, "Okay, we're gonna have to call her endo, like, we're gonna hold the
Yeah,
script till we find out," and we found out it was not. But
yeah,
yeah,
yeah.
but that's interesting.
It is, it's interesting, GLP-1, and then the other thing, I don't know if you've done a lot of research on this, but is naltrexone, low dose
I'm
naltrexone.
on it.
Yes, that was like, I literally was like, if I could put a billboard up that says, "If you have autoimmune illness, Hashimoto's, endometriosis,"
We put
and
a
that
lot of patients on it.
yeah, take low-dose naltrexone. It's funny because, there's a local pharmacist that has a compounding pharmacy here in town, her family does, and she went to, A4M a few years ago,
Yep.
and, she texted me while she was there, and she's like, "I really think you need to look into low-dose naltrexone." And I was like, I don't know," and so she sent me a little bit of information, and, I went in the pharmacy one day after that, and she was like, "Listen, like, you really need to look into this. Like, I really think this is a big game changer." And I was like, "Yeah, I'll look into it." And, I just was like, "Man, I didn't really look into it, to be honest with you." I was at a hormone conference like 2 years later, and they did a talk about low dose naltrexone for treating Hashimoto's and how the antibody burden reduces so significantly. And they showed actual lab values of antibody burden, how many antibodies they had for TPO antibody before and then after I was sold. So I text her from that conference. I was like, okay, I said, and her compounding pharmacy, has that. And I was like, okay, when I get back, I want low-dose naltrexone.
Yeah.
And it has made that fatigue that I talked about. I feel
Yep.
like it helps that. It's helped with, of course, my weight loss journey was a little bit, kinked with all the fertility that we did for a few years, but I'm trying to get back on, find that it helps with that. It helps with my sleep. I mean, just so many things.
It's been a game changer for me, and it's funny,
Yeah.
when I got diagnosed, I'll never forget, I was going to a store, and I was walking in with this elderly couple, and I had just been diagnosed, so I'm, like, crying all the time, and I don't what did she say? Oh, the husband said to her, "Life is short, buy the hot tub." And I looked at them in the parking lot while crossing the street, and I said, "Yeah, buy the hot tub. I just built a pool because I got diagnosed with MS." And they stopped. And the woman looked at me and she goes, "I have MS." And I'm like, "Stop." And she's like, "3 letters, LDN." And, like, I let it go in and out my ear, 2, 3 years go by, my boss is A4M trained, lifestyle medicine, "You gotta do LDN." I'm like, I'll think about it." And then my pain got bad, I thought I was having a flare, it wasn't, it was a pseudo flare, and that's when I'm like, "Alright, too many people are shoving this down my throat, I'll start it." So I did, and I just increased my dose, like, 3 weeks ago.
Yeah.
Well, Dr. Chatterjee-Morris, thank you so much for sharing your journey with us. Your story is a powerful reminder that resilience is built in the moments we choose to keep going, even when the path may look different than we expected. If this conversation inspired you, please share it with someone who needs the reminder today, and follow MSwired Podcast for more stories that redefine what's possible.